Good morning. Thank you so much for joining us for this webinar this morning for Open Enrollment. My name is Jessica Shee. I'm the Communications Director at the Health Service System, and I'm just here to give you a brief overview for how this webinar will work. If we can go to the next slide. Great, so today everyone will be on mute for the entire presentation. However, we definitely want to hear your questions. So if you have a question for us, please look on your menu bar, which may either be at the top or bottom of your screen, depending on if you're joining from a computer or a mobile tablet or phone. If you find that menu bar, look for the little question mark box. And if you hit that question mark box, you'll be able to open up the live Q&A chat, and you can send us a question that way. And we've got our Q&A moderator standing by to help us answer your questions, as well as all of our health plan vendors today. This is the Medicare health plan presentation and general overview. And if your question is more complex in nature or personal, we also recommend that you do a one-on-one consultation with any of our health plans or with the health service system. You can always call our member services for assistance. Okay, Derek, play the video. Thanks so much.
Hi, my name is Kathy Frierson. I have been with the Health Service System for over 21 years, and I am one of 25 benefit analysts who answer your calls when you have questions about your benefits. If you're thinking about retiring, as I am as well, please remember to set up a meeting with your retirement system. And if you are over age 65, please make sure you have your Medicare A and B in place before scheduling your appointment with the San Francisco Health Service System. If you're already retired, many retirees call us to help them navigate their benefits through life events like marriage, divorce, or moving to another area. We here at Health Service System are here to guide you through this important time of your life. This webinar will explain the Medicare health insurance benefits options. If you ever have questions, you can always call Health Service System. Take care, be safe, and stay healthy. Thank you.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan, which makes your life easier. Today, I'll be highlighting your plan benefits, our integrated quality care, digital care options, and membership perks. This information will help you select with confidence the right health plan for you and your family. Now, are you ready to get started? Great, let's begin. We can help you get to your healthy place, no matter where it is. We combine care and coverage, which makes us different than your other healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you through our electronic health record. They can see your health histories, such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, or even pick up your prescriptions all without leaving the building. Care feels easier and faster and is centered around you. Having a doctor you connect with is essential to getting excellent care. Your personal doctor is the biggest advocate for your health and will help coordinate the care you need to get healthy and stay healthy. Members can choose or change doctors at any time for any reason by browsing our online profiles at kp.org/search doctors. You have the freedom to choose a physician that best meets your needs. You can search doctors accepting new patients by gender, location, languages spoken, and even view their photos, education, and credentials. Next, let's review how we're leveraging technology to provide convenient ways to get care. When you need care, you can have an appointment in person with your physician, over the phone, or video. You can get advice 24/7 over the phone, online through an e-visit, or email your doctor's office with a non-urgent question and get a response within 2 business days. You can also manage your care at your fingertips anytime and anywhere. Schedule or cancel routine appointments online, refill most prescriptions, check most lab results, and even pay your bill. Next, let's look at the many care options while away from home. Since keeping you safe and healthy is our first priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at minute clinics or Concentra urgent care centers when you're traveling outside of a Kaiser Permanente area. If you seek urgent care at a minute clinic or Concentra urgent care center in a state where there's a Kaiser Permanente facility, but you're outside of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, contact the Away From Home travel line, available 24 hours a day, 7 days a week, and visit kp.org/travel. Now let's review some of the membership perks to help you feel your best. Good health goes beyond the doctor's office. Here are some of the wellness resources available at little or no cost to help you thrive. Members can take advantage of our health education classes, wellness coaching by phone, and online wellness tools to improve their health and save money. In addition, you can stay physically and mentally fit with these wellness offerings. ClassPass, which provides on-demand video workouts and live stream fitness classes, including Pilates, dance, and boxing. And self-care apps such as Calm, to practice mindfulness with guided meditations, relaxing music, and sleep stories. Lastly, get special rates on a variety of services and gym memberships through our Choose Healthy program. These include specialty care services such as acupuncture, chiropractic care, and massage therapy. Now, let's look at a high-level overview of your Kaiser Permanente Senior Advantage plan with the City and County of San Francisco. This plan offers comprehensive coverage at a copay or coinsurance. There's no annual deductible, and the out-of-pocket maximum is $1,500 for an individual or $3,000 for a family. This is the most you'll pay out of pocket for most covered services during the accumulation period. Preventive care is covered at 100%. Office visits are a $20 copay per visit. You can save money with phone and video visits with your doctor, which is offered at no cost. Hospitalization is a $100 copay per admission. Emergency care is a $50 copay per visit. And lastly, prescription medication up to a 30-day supply is a $5 copay for generic, a $15 copay for brand name, and a 20% coinsurance not to exceed $100 for specialty. If you take routine medications, speak with your doctor about our mail order service to receive up to a 100-day supply for only twice the copay. Next, let's look at other benefits offered through your plan. Your plan also covers hearing aids, acupuncture, and chiropractic care. For hearing aids, you get a $2,500 allowance for each ear every 36 months. Chiropractic and acupuncture care are offered through the American Specialty Health Network. No referral is needed. You're eligible for 30 combined visits per year at a $15 copay per visit. To find a participating provider, use the link or the phone number provided here. Now let's highlight some additional benefits for retirees of the City and County of San Francisco. These benefits are offered to you at no cost. The Silver and Fit exercise program can help you stay active by joining a participating fitness center or trying our home fitness kits. The Medicare Meals benefits provide fresh, healthy meals delivered to your home immediately following an inpatient stay at a hospital or skilled nursing facility. Your plan covers 84 meals per year. And lastly, you can get a ride to and from your appointments with your transportation benefit. Your plan covers up to 24 one-way trips, 50 miles per trip per calendar year. Now, in case you're new to Kaiser Permanente, let's go over what you can expect when you join. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide, so it is easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and your prescriptions seamlessly, and schedule your first appointment. If you're switching from another health plan, we'll help you with the transfer of your medical records and prescriptions. If you still have questions, we're here to support you. Choosing a health plan is a big decision, but you don't have to make it alone. We're here to answer any of your questions so you can make an informed decision. If you have questions about the essentials or the extra features, call the number listed on the screen. For additional information and plan documents, please visit the microsite listed on the slide, where you'll find content tailored specially for City and County of San Francisco retirees. Thank you for your time and attention. Today, we review the benefit of choosing Kaiser Permanente, the resources to help manage your plan, and membership perks available at little or no cost. Now you have the information you need to select with confidence Kaiser Permanente as your health plan. We look forward to providing quality, integrated care for you and your family very soon. May you live well, be well, and thrive.
Welcome, and thank you for taking your time today to learn more about the United Healthcare Group Medicare Advantage PPO plans designed specifically for San Francisco Health Service System retirees. There is a plan available for those of you with Medicare Parts A and B, and another plan for those of you with Medicare Part B only. Both plans have the same benefits and coverage. During our time together today, we will be reviewing your plan benefits and what to expect next if you decide to change enrollment. To learn more about the United Healthcare programs and features that are also available with these plans, please consider joining one of the additional presentations. The United Healthcare Group Medicare Advantage PPO plans will cover all of the benefits of Part A, your inpatient hospital, skilled nursing, and home health, as well as all the benefits of Part B, your doctor's office visits, outpatient care, and labs, and the Part D prescription drug coverage. As well, we offer many additional benefits and programs. You are still considered to be covered by Medicare, but all of your benefits and claims will be administered by United Healthcare. Your United Healthcare Group Medicare Advantage PPO plans are national PPO plans. What that means to you is that you will be able to see doctors, clinics, and hospitals all across the United States and the U.S. territories. Under the plans, there will be coverage for podiatry, vision, hearing, chiropractic care, and acupuncture, as well as prescription drug coverage. There are no referrals needed to see a specialist. The national PPO plan lets you see providers in or out of the United Healthcare network for the same cost to you, as long as the out-of-network provider participates in Medicare and accepts the plan. This means they are willing to bill United Healthcare. The provider you are currently seeing may already be in the United Healthcare network under your plan. To confirm if your provider is in the network, you can check online at www.uhcretiree.com/SFHSS, or by calling United Healthcare Customer Service at 1-877-259-0493. The The customer service team may also be able to assist by confirming if your provider participates in Medicare and accepts the plan. Now I will discuss the specific copays you pay per service. If you seek service with your primary care doctor, you will pay a $5 copay. For a specialist office visit, you will pay a $15 copay. When you go to an urgent care facility, you will pay a $20 copay. You will pay a $65 copay when you visit the emergency room. The copays for urgent care and emergency care are waived if you are admitted within 24 hours. You will pay a $150 copay for each hospital stay, and you will pay a $100 copay for outpatient surgery. Under this plan, all preventive services such as annual physicals, immunizations, breast cancer screenings, and colon cancer screenings are covered at no cost to you. This slide shows some of the additional benefits included with the plan. You are covered for routine foot care for up to 6 visits per year. Your cost is a $15 copay per visit. Your routine hearing coverage provides 1 hearing exam per year at no cost to you, and you have a $5,000 hearing aid allowance every 3 years. You are covered for 1 routine eye exam per year, and you will pay a $15 copay at that visit. You have an allowance of up to 24 routine chiropractic visits per year, and you will pay a $15 copay per visit. You also have up to 24 acupuncture visits per year, and you will pay a $15 copay per visit. Your plan includes prescription drug coverage, or Part D. You have the option of using over 67,000 United Healthcare in-network pharmacies. There are thousands of covered brand name and generic prescription drugs available. You can check the plan's covered prescription drugs by going to www.uhcretiree.com/SFHSS or by calling customer service to review your prescriptions. The customer service phone number is 1-877-259-0493. This slide shows what you will pay for prescription drugs. Tier 1 includes all covered generic drugs, and you will pay a $5 copay for a 30-day supply at retail or a $10 copay for a 90-day supply through mail order. Tier 2 includes many brand name drugs called preferred brands, and you will pay a $20 copay for a 30-day supply at retail or a $40 copay for a 90-day supply through mail order. Tier 3 includes non-preferred brands, and you will pay a $45 copay for a 30-day supply at retail or a $90 copay for a 90-day supply through mail order. Tier 4 includes specialty drugs, and you will pay a $20 copay for a 30-day supply at retail or a $40 copay for a 90-day supply through mail order. There may be more ways that you can save under the plan. One of them is by reviewing your medications at least yearly with your doctor. Maybe a generic or less costly drug has been developed that will help you stay healthy that can also reduce your costs. Be sure to use your United Healthcare ID card when you go to the pharmacy, and make sure you use a participating pharmacy. You can also choose to use the OptumRx mail order and receive the 90-day supply of your medication for just 2 copays instead of 3, which will not only save you money, but also the added convenience that your medications are delivered directly to your home. If you are already a member of a United Healthcare Group Medicare Advantage PPO plan and you are happy with the plan, you do not need to do anything and you will remain enrolled for the 2022 plan year. Both newly enrolled members and those who are already enrolled will receive a new member ID card in December along with a quick start guide that gives you more information on how to get the most out of your plan. You can start using your member ID card on January 1 of 2022. We do encourage you to register online at www.uhcretiree.com/SFHSS to access your plan information, view claims, and get your explanation of benefits online. You will need your member ID card to register. If you are new to the plan, we will contact you soon after your effective date to welcome you to the plan. United Healthcare wants you to know that your benefits through San Francisco Health Service System do offer you much more than the coverage discussed in this presentation. We recommend you consider joining another presentation to learn more about the additional plan benefits, programs, and features available to you as a member of our plan. Or if you would rather review the information on your own time, you can do so through our virtual education center. You can view online flyers, brochures, and videos, all by going to www.uhcvirtualretiree.com/SFHSS. On behalf of United Healthcare, we want to thank you for your time today, and we look forward to welcoming you to our Medicare family. If you're already a member, we welcome the opportunity to continue to serve you. Thank you for listening.
Hi, I'm Carrie Bashirs, Wellbeing Manager with the San Francisco Health Service System. Today, I'll spend a few minutes with you highlighting some of the free wellbeing resources available to our retirees. First, I'd like to highlight some of our support programs that we offer. First is a diabetes prevention program, which is a year-long program in which you would need to pre-qualify. We also have a healthy habits offering. It's a 10-week program that focuses on healthy weight or weight management. Also, it addresses topics like sleep, physical activity, and healthy eating. We also offer lifestyle coaching. And then currently during the flu season, we offer on-site flu clinics at various worksite locations. So go ahead and get a scheduled appointment today. We'll start flu clinics in September and run through November. Additionally, we do offer some resources that you can check out. First is Crediblemind. It's a resource hub that offers over thousands of different articles, newsletters, apps, blogs that you can search on various topics that are most relevant to you that focus on mental health and well-being. We also offer webinars and classes. You can attend those virtually right now. So seminars might be things that focus on resiliency or mindfulness or even healthy eating. Classes, also group exercise classes. And then we do offer gym discounts. And then most recently, we've launched a website page that focuses on social connectedness. So you can find ways to connect and empower, look at what's available in your community, and really just try to stay connected in these times. So for more information, please feel free to contact us at WELL-BEING@sfgov.org or give us a call at 628-652-4650.
Thank you so much to all of our presenters. And now we have basically my favorite time, which is Q&A. So I already see we've got a couple of questions in our chat. Thank you so much for submitting them. And I'm going to start from the top. One of the first questions is from TJ. Thank you so much. I'll be turning 65 in January, and I've applied for Medicare. How should I enroll if my Medicare card or letter has not arrived before the close of open enrollment? And Sonali, thank you for answering that. So if you are turning 65 in January, you will need to submit the Medicare card or the award letter to SFHSS by the first week of December. You only need to use open enrollment if you're making any changes to your current plans. So right now you'll probably be able to access and enroll in one of the early retiree plans. But come January, you'll be able to apply for one of the great Medicare plans that were just presented earlier. So thanks so much for sending that question over. Next question is from another member. I am retired and my spouse will turn 65 next September. What do we need to do to transition into Medicare within the health service system? So Sonali, thank you again for answering this. Your spouse will need to enroll in Medicare Part A and B 3 months before he turns 65, or she. For more information, please visit our website at sfhss.org. Thank you. And she also included a link for retirees with Medicare. It also sounds like if your spouse doesn't turn 65 until next September, please make sure you enroll in one of the early retiree plans that we have. And we have webinars on that as well. So will this webinar be recorded, and can you come back and to review it again? Absolutely. And you'll be able to find the video in the same calendar that we created. So if you select this webinar on this day, you'll be able to see that probably in a day or two, we'll have the video posted there in our calendar. And Mary asked, could you talk more about the gym and wellness benefits? So that's a great question, and I know you have a little addition to that, but I'd like to give that to both of our health plans here today. Julie, could you start with Kaiser? Could you share more about our gym and wellness benefits?
Sure. Well, firstly, all of the Kaiser Permanente Medicare Advantage members through SFHSS, you have what's called Silver and Fit. So you don't actually need to use our discount program for your gym membership. So Silver and Fit gives you a free gym membership at a participating facility, as well as access to home fitness kits and a number of different tools on silverandfit.com. You can view live workouts, look at videos. There's a number of different calculators, articles on fitness, so helping you to stay healthy. As far as the discount program, I think the question was about massage therapy. If you go to kp.org/exercise, there are a number of different wellness tools there. Specifically for massage therapy, you would click on Choose Healthy. And then for acupuncture and chiropractic, that is a rider that you have through SFHSS. So you should take advantage of that rider, which gives you 30 visits for your regular office visit copayment of either acupuncture or chiropractic, and there's no referral needed to get those services. Thank you.
Thank you. And Jan, could you share the benefits with United Healthcare?
Yeah, you have, with United Healthcare, you have access to silver sneakers at no cost to you. So that's your free gym membership. Many gyms available to you, as well as online workout videos available. So there's that for you. No access, special access or anything needed. If you wanted to call Silver Sneakers to get your ID number, I can give you that phone number. That is 888-423-4632. Or you can visit their website to view the gym locations, and that's silversneakers.com. And then we do have other health and wellness benefits available to you. Once you become a member, you can review all of the information through the uhcretiree.com website. You would log in and you can look at all of our renew information, which gives you access to all sorts of lifestyle tips, recipes, brain health games, all sorts of that good stuff for you is out there. And then I think Kaiser mentioned about their chiro benefit, and that was part of our presentation as well, but we do have chiropractic coverage for you under this plan.
Thanks.
Did I miss any part of that question, Jessica?
Massage benefits.
Oh, we don't have massage. We just have chiropractic care and acupuncture. So the chiropractic care, you do have a $15 copay up to 24 visits per year. And then acupuncture is $15 copay, also up to 24 visits per year.
Thank you so much. And the next question is, will this webinar cover Medigap plans or only Medicare Advantage plans? So yes, this is the Medicare Advantage webinar. We do not, thank you Sonali for answering that question. We do not have any Medigap plans. If you are not yet eligible for Medicare, that would mean that as an SFHSS member, you qualify for our early retiree plans. And so you can continue to get healthcare coverage that way. The next question, oh, and of course, our two Medicare Advantage plans are Kaiser Permanente Senior Advantage and the United Healthcare Medicare Advantage plans. Now, the next question is, how do we register during open enrollment if I am not eligible for Medicare till January 2022 and my spouse isn't eligible for 5 years? So thank you, Sonali, for answering. So open enrollment is for making plan changes for your medical, dental, and vision benefits. It's also the opportunity for you to add or drop any dependents. Now, regarding Medicare eligibility, you can just submit the Medicare proof 1 month in advance of the month you are becoming Medicare eligible. So that may be when you turn 65. If you are enrolled in Kaiser, you will be enrolled in the Kaiser Senior Advantage, and if you're enrolled in other HMO or PPO plan, then you will be enrolled in the United Healthcare Medicare Advantage plan. So for more information, you can always go to sfhss.org or reach our member services if you have any questions. Does any of the United Healthcare or Kaiser work with Medigap? I'm unclear on that. So I don't know if you want to answer that question, but once again, we do not offer Medigap plans under SFHSS. However, if you wanted to purchase insurance on your own, Julie, if you don't mind taking that first.
Yeah, I will. I think sometimes there's some confusion over your Medicare options. So CMS does offer Medigap and Medicare Advantage plans, but what HSS offers are Medicare Advantage plans. And remember, those cover you for all of your Part A and B services, and they all also include Part D prescription drug coverage. So there's nothing else you need. There is no need for a Medigap because there are basically no gaps through HSS. So I would advise, if you're eligible for benefits through HSS, that you remain with them. Thanks.
Jan, do you have anything to add to that?
No, I think Kaiser covered it well. Thank you, Julie.
Thank you. And Sonali, did you say something? I'm sorry if I cut you off.
No, that's fine. I just wanted to add to Julie's information. So with Medicare, they cannot enroll in any other plan. So there's no dual coverage allowed with Medicare. So if they enroll, then they will lose coverage with HSS. So they need to be mindful of that. If they are not actively seeking to enroll, they shouldn't enroll in other plans.
Thank you so much for that. That is a great reminder, and we don't want anyone to lose their coverage. So great question. And the next question is, what is the difference between Medicare Advantage plan versus the Medigap plan? I think Julie just answered that, so thank you so much. And the next question is, hi, my husband is retiring in November, and I would like to add him to my UHC health plan. He's 66 years old and he doesn't have Medicare yet. What do I need to do? So Sonali, thanks for answering. He will need to enroll in Medicare Part A and Part B to be eligible to enroll in the health service system Medicare plan. Due to the specific nature of your question, she really recommends that you contact SFHSS member services, and she provided the phone number in the chat box, which is 628-652-4700. Thank you so much, Sonali, for answering that. Next question from TJ, thank you so much. Are Kaiser and United Healthcare the only options for Medicare retirees? Yes, they are your two options, and they do cover a great amount. I think Jan had mentioned earlier, United Healthcare is available anywhere in the United States. And Kaiser Permanente is available in also many regions within the United States. And the next question is for United Healthcare. How is the city plan different from other Medicare supplement insurance plans available commercially, such as AARP? So the United Healthcare Medicare plan is not the city plan. And then Jan, could you explain how it differs from other plans like the ones offered through AARP?
Yes. Well, so there's actually quite a few things, but being that this is a group Medicare Advantage plan, we have worked very closely with San Francisco Health Service System, and there are specific benefits negotiated under these plans specifically to you. So one of the pieces right off the bat is that plans out in the open market require that everybody has Medicare A and B. With the San Francisco Health Service plans, you can have Medicare A and B or Medicare B only. So that's one big differentiator right there. There are going to be other differentiators like chiropractic care, acupuncture care. We have additional coverages for hearing, as well as the drug coverage. And this is the big one. Most of the plans out in the open marketplace are going to have differing stages depending on how much medications and how much you spend throughout the year, and your benefit is going to change. With this plan, you have very, very good coverage. You have great low copays, and once you do hit the catastrophic stage, you stay into a flat copay plan, and that's specifically negotiated for these San Francisco Health Service systems, and nothing you're going to find out in the open marketplace. Let me think if there's anything else. We have a few other things. Also, mental health benefits. We have additional coverage negotiated for this San Francisco Health Service plan.
Thank you. And for both our Medicare plans, we also offer the transportation services. I'm not sure, did you already mention that? I apologize.
I didn't mention that. Thank you. There's many, many benefits we've negotiated and added to these plans. So I do recommend that you thoroughly analyze all of the additional benefits and features of this plan before considering not taking it, because these are really, really great, rich benefits.
Thank you so much, Jan.
Sorry.
So the next question is, what does early retiree mean? A great question. And Sonali, thanks so much. So retirees who are not yet Medicare eligible due to disability or age, which is when you turn 65, are considered early retirees, and you are able to access the same plans that we offer our active employees. And TJ has a clarification to the question. Just to clarify, I would apply as a retiree during open enrollment, and after I get my card sometime in December, I would file a new application as a retiree with Medicare. Sonali, is that correct? So if you are getting, if I'm following the chain correctly, if you turn 65 in January and you get your Medicare card in December, yes, you would transition to the Medicare plan. Now, Sonali, could you clarify if, for instance, if TJ is currently with Kaiser, will TJ automatically be enrolled in the Kaiser Senior Advantage Medicare plan?
That is correct.
Okay, so you will automatically enroll in those plans. Thank you. And the next question is, can I switch between the two Advantage plans during open enrollment? For example, if I'm automatically enrolled in United, can I switch to Kaiser the following plan year? Yes. So open enrollment is the perfect time if you want to switch. This is your chance to switch. So feel free to go into, actually you should have access to the employee portal, and you can make your elections directly online if you would like to switch during open enrollment. Thank you so much for that question. And so another question is, if you retire at 62 and do not qualify for Medicare, what plan do you sign up for? Great question. You're considered one of our early retirees who are not yet Medicare eligible, and you can apply for the same plans that are available to our active employees and early retirees. And we have the next webinar for that is on October 13th at 11 a.m. So please check your, we'll be sending out email invites with reminders for all of our upcoming webinars, and we do hope to see you there. The next question is, once enrolled in Medicare Advantage plan, do we keep the same dental and vision plans we currently have? I see Sonali is replying to that post, but basically you have different options for dental and vision. I believe there's 2 vision options. The basic vision coverage comes with your medical health plan. You can elect to have the Premier Vision plan if you're like me and you have glasses. And let's face it, glasses cost a lot of money, or contacts. You can certainly increase your coverage by electing the Premier plan. You also have dental benefits through the San Francisco Health Service System, but that is not tied to your medical plans. We actually have a special dental and vision for retiree webinar, and I'm looking it up on the calendar now. Do we know when that? Oh, here it is. On October 12th is a retiree dental and vision webinar. So I hope you will join us for that one. And the next question, will you give information about our retiree dental choices? Oh, thank you. And thank you, Holly, for responding. So we have a special retiree dental and vision webinar that will cover all of your dental and vision benefits. Thank you so much. Next question, I have Blue Shield for myself and husband. We're both over 70. I will probably retire in January. What do I need to do? So this is one of those things you would go through the San Francisco Health Service System. We highly recommend you schedule a retiree consultation, and they will walk you through all of your steps. There's actually, we break it down into 3 basic steps, but the first thing you need to do is inform your Sonali, what is it called? Their retirement system. Sorry, your retirement system. It may be SFRS or maybe another group. So you let them know that you intend to retire and the date that you intend to retire so that they can go through all of your paperwork for retirement. And then you bring that paperwork to SFHSS or provide it during your retiree consultation. They can walk you through all the steps. And of course, since you are already over 70, you are eligible for Medicare, and you should apply for Medicare Part A and Part B if you haven't already, and you bring that with you during that consultation. So, and Sonali, thank you. I can see you're responding to that post, to that question. The next question is, I thought we need to enroll in both Medicare Part A and Part B. The presenter just said we can enroll in Part B only. I don't understand. Well, thank you for that question. I think it really depends on your union that you're retiring with. But in general, we would require that you enroll in both Medicare, the premium-free Medicare Part A and Medicare Part B, which may or may not have a premium depending on your income. The next question is, has City Plan disappeared, gone forever? No, it hasn't disappeared at all. So the City Plan is just the PPO plan. And if the Medicare plan has never been the City Plan. So the United Healthcare Medicare plan is a United Healthcare Medicare plan. I think there's a little confusion because there was also the United Healthcare PPO plan that was for non-Medicare eligible members. And sometimes we call that the City Plan, but it is just a PPO plan. And we still have a PPO plan available for both Medicare retirees as well as non-Medicare members. The next question is, what is Plan A? I assume that means Medicare Part A, and what does it cover? Jan, do you want to take that?
Sure. Medicare Part A is usually your hospital or anything inpatient benefits related to that. With a Medicare Advantage plan, you don't need to worry too much about where your coverage is received because everything will be billed to United Healthcare, or if you're with Kaiser, directly to Kaiser. But typically A is your inpatient hospital and B is your anything outpatient like office visits and doctors at your doctor's office and so forth.
Thank you. And the next question is, does my husband, who is not Medicare eligible, get to stay with UHC PPO if I go to UHC Advantage? Or do we need to register for coverage for him during open enrollment? That is a great question. Jan, do you want to take that?
Sorry, I missed the question. Could you repeat that? I was trying to respond to a question in the Q&A.
Oh, I completely understand. So the question is, does my husband, who is not Medicare eligible, get to stay with UHC PPO if I go to UHC Medicare Advantage? Or do we need to register for coverage for him during open enrollment?
We do have the United Healthcare non-Medicare companion plans. So the non-Medicare spouse could stay with our United Healthcare plan. I think you have some other meetings, Jessica, for those if they wanted to attend one of those sessions. And then the Medicare retiree would stay on the United Healthcare Medicare plan.
Yeah, I hope that answer makes sense. So it sounds like our member is the one who is not yet Medicare eligible. And yes, you get to, we have what we call a UHC companion plan. So if your spouse or husband is Medicare eligible, he would have access to the United Healthcare Medicare plan, and you would be able to have the United Healthcare companion plan. So thank you. And then the next question comes from our member, Rama. I use many medications. It seems I would pay much more with United Healthcare versus Kaiser. Is that correct? Julie, do you want to take that for Kaiser?
I just missed the first part of that question.
So we have a member who has many medications and they're looking at the cost for their medications and they feel that the cost would be better with Kaiser.
Okay. I think the medication coverage is pretty similar. Let me take a look.
I am looking as well. Yeah, $5 for 30 days.
Right.
Oh, if it's a brand name drug, and correct me if I'm wrong, Jan. So brand name drugs, Kaiser, it's $15 copay, and United Healthcare is $20 for a 30-day supply. So it is slightly more there, and
for United Healthcare, it really depends on the brand name drug because there are a couple of different tiers it could fall into. It might be a good idea to speak one-on-one with Kaiser and United Healthcare so that we can more thoroughly and privately answer your and review your specific medications. So we each have office hours that you can attend, and I know that United Healthcare is this afternoon at 1 o'clock Pacific time.
Yes, and you can access, and actually, Holly, if you can put in the post where they can access the health plan office hours, that would be wonderful. And the next question comes to us from Bill. Under the United Healthcare plan, is there any long-term care benefits? If so, please explain. And Jan, thanks for answering there. Could you repeat your answer for the benefit of all?
Yeah, long-term care, such as a nursing home facility, that's typically that's not covered by United Healthcare. Typically, it's not something that falls under a Medicare Advantage plan, although I can't speak specifically to other carriers. We do have other types of facilities that are covered, such as skilled nursing or other rehab facilities.
Thank you for answering that. Next question is, my spouse is turning 65 next year. We understand we must apply for Medicare 3 months before turning 65. What if Medicare does not provide proof of coverage in a timely manner within the 3-month period for us to get it to you before turning 65? What other paperwork do we need to provide the health service system? And Sonali, I can tell that you're responding to this post. Could you also provide the answer for everyone?
Sure. I was thinking how to craft it. So usually Medicare, if they apply 3 months in advance, they should be able to get their card or the award letter in a timely manner. If they do not have the card yet, then they can send us the award letter, which should have the MBI number and should say that they have enrolled in Medicare Part A and Part B. Let's say for some reason they do not even receive that, then they can go to the website and print that out. So yeah, so they should receive it in that time span. And if they have, for some reason they have not, then they can call SFHSS, and then we can advise them further based on the specific circumstance.
Thank you so much for that, Sonali. And the next question is, are there transportation benefits with United Healthcare? And I see Jan's already answered that question, and we're happy to say yes, it's one of the benefits of having the group Medicare Advantage plans. Jan, will you repeat the answer for all?
Sure. Of course, in addition to your emergency ambulance coverage, we do have ambulance coverage covered. And then in addition to that, we do have routine transportation. We have up to 24 one-way trips per calendar year. There are just a few additional details to that. You do need to call them and schedule an appointment 2 days in advance and a few different things, but that is all covered for you, so not to worry.
Thank you. And similar coverage is also available with our Kaiser Permanente Advantage plan. Julie, do you want to elaborate on that?
Sure. You can get up to 24 one-way trips of up to 50 miles per trip per calendar year. And this is also in addition to ambulance. Of course, your ambulance is covered, but this would be for rides to doctor's appointments or back home from doctor's appointments, picking up prescriptions, picking up any sort of durable medical equipment, or getting any lab or x-rays.
Thank you so much.
Julie, I can add just a little bit more too. We do have the routine benefit as well as post-discharge. So if you've been recently discharged from an inpatient hospital stay, you do also have unlimited routine transportation for up to 30 days after that. So
excellent.
Extra benefits.
Excellent. Thank you both for answering that. And I want to say, I know many of our retirees may be looking to get their booster shot for COVID, and you can actually use this benefit to help you get to your appointment as well. So thank you so much for that. Susan has our next question. I turned 65 at the end of February 2022. Should I continue with open enrollment now, or does it automatically change to the United Healthcare plan when I turn 65 once I apply to Medicare? When I called HSS regarding this question, I was told we would get something in the mail when it is our time to apply for Medicare. Is that true? So thank you so much for asking this question. It is, of course, open enrollment now. You are eligible for one of our active employee and early retiree plans right now. And so that one would be in effect for January of next year. However, when you turn 65 in February, you should, I'm just trying to do a little math here, I guess in November, you should apply for your Medicare Part A and Part B, and you should go through your consultation with SFHSS, and they can help you with the transition. So if right now you are on Kaiser Permanente, you will then transition in February to Kaiser Permanente Medicare Advantage. However, if you are on Blue Shield or any of the other HMO plans that we have, you would then transition to United Healthcare Medicare Advantage. Sonali, is that correct? Please fact check me. I want to make sure I give people the correct answer.
Sorry, I wasn't listening. Sorry, what's the question? I'm sorry, Jessica.
Oh, so if Susan is turning 65 in February 2022 of next year, I'm telling her she should apply for Medicare in November. However, if during open enrollment right now she elects or she's already with Kaiser, then come February she will be a part of Kaiser Permanente Medicare Advantage. However, if she's with like a Blue Shield plan or another HMO plan right now, come February, she will then transition into United Healthcare Medicare Advantage. Is that correct?
That is correct. And she can use open enrollment to make any plan changes, like if she is in Blue Shield and she wants to enroll in, if she's in Trio, she wants access, she can do those things till plan changes to Medicare Advantage in February. And she can also make plan changes for her dental and vision coverage during open enrollment. But whatever plan she is, if she's in Kaiser, it will be defaulted to Kaiser Senior Advantage. And if she's in other HMO or PPO plans, then it will be United Healthcare Medicare Advantage.
Great, thank you so much. The next question.
And Jessica, this is Holly, one of our moderators. I'm just looking at the time. I know we have quite a few questions left, but we're almost at the top of the hour. So I'll be putting in some website links for anyone to find further information.
Oh, excellent. Yes, if you could. And also, can we, we're going to try to answer as many questions as possible with the remaining time. But Holly, could you also help us put the raffle prize? So we want to thank everyone for attending today. We do have a raffle drawing. So we're going to share that with you. You can enter your name and email, and we'll tell you how you can pick that up in November at our wellness center. And of course, Derek, thank you so much for switching that slide. Can you go back to the slide just before this? If you have more questions, we do highly recommend you take advantage. All of our health plans have offered one-on-one office hours and consultation. So if you go to our webpage, sfhss.org/OE2022, you'll be able to just scroll down a little bit and you'll be able to see links where you can schedule your one-on-one office hours, and you can really go deep, ask them your situation, whether it's about your medications or anything else, if you want to compare plans and understand the differences there. So we definitely recommend that. And of course, we also have a calendar there of all of our other webinars. Like later this afternoon, we actually have one for mental health support, and tomorrow we have one for chronic conditions. So thank you. And thank you so much, Holly, for keeping us on track. I am going to try to respond to more questions here and we do really appreciate everyone's time. Does UHC offer reimbursement for flexible spending for health? So the flexible spending account is completely separate of your medical plan, and as a retiree, you don't qualify for a flexible spending account because they can't pull the pre-tax dollars out of your paycheck. But United Healthcare actually has this cool program where you get rewarded for staying healthy and taking certain actions. Jan, what is that program called?
The Renew Rewards.
Yes.
Yes, yes. So if you get your annual physical and wellness visit, you can also be rewarded for getting those. So we'll send you a Visa gift card thanking you for taking care of yourself.
Ooh, sorry about that. Thank you so much. And we are at time right now. I am so sorry that we weren't able to get to everyone's questions. Please reach out to us for one of our office hours, or if your question, and looked like many of your questions today were really about your account and your member benefits with HSS, please feel free to reach out to SFHSS as well. Can we go to the last slide? Thank you. So this is how you can reach SFHSS member services for retiree consultations, for questions about your transition, into Medicare, and these are our office hours. I want to thank everyone for attending today, and thank you for all the wonderful questions. We really appreciate those. I hope if you want to do a deeper dive on some of the topics, you will look at our event calendar for open enrollment and join us for any of those other topics as well. Thank you and have a great morning.